Welcome back to Plastic Surgery Untold, greatest podcast in the world as voted by us. Kicking off 2024 with our dream team here. You know, one of my absolute favorite topics, because it's personal to me, structural synergy. You know, I've evolved this from structural sandwich to synergy just because I think there's a lot of synergistic effects that you can have when treating skin laxity. In the center of the weight loss revolution, half of us on this panel have been part of it. Others have been part of it in terms of providing and helping guiding all of our team throughout their fit and fabulous journey. But, you know, skin laxity is going to be probably the biggest issue in 2024 and honestly, probably for the next 4 or 5 years. So let's introduce our Dreamcast. Then let's talk about how we're going to treat skin laxity with some of the minimally invasive, non-invasive techniques. I think there's some really, really cool combination treatments coming in 2024, some new technologies, but I think it's really going to be how you integrate those together that are absolutely fabulous. So we'll start with the left and kind of roll around. Jenna, how are you? And introduce that to all your fans.
Yeah, I'm doing great. I've been really enjoying this time recently with my baby. She's 18 months old now. And honestly, things have been great at the office. I mean, we've been seeing so many patients in the weight loss world as well as just med spa and aesthetics in general. So really enjoying it.
All right, I'm Sarah, one of the nurse injectors here. Been a busy weekend. I actually entertained about 9 9-year-olds. So I survived that. Back here today to chat with y'all. But I couldn't agree with Jenna more. I, personally lost about 40 pounds. So I've done some of the structural synergy stuff myself, thanks to y'all. But I think combination treatments, like you mentioned, Dr. Franco, has really evolved to create these awesome results. I feel like that's going to be the key this year. So really exciting things coming up.
And we'll circle back to you because I think a lot of times when people think of skin laxity, from a med spa or non-invasive, a lot of people think about face and neck stuff, but hopefully you'll talk a little bit about butt, thighs, knees. Some of the lower extremity is a frontier that we're only scratching the surface in an area that is honestly surgically can be challenging to treat. So let's come back to that because I think that's going to be super important and a huge frontier in 24.
Yeah, one of my favorites.
Nikki, I think this is your first podcast.
Yeah, first podcast.
Super excited to have you. So tell us a little bit about you.
Yeah, so super happy to be here. One of the estheticians at the clinic, and I've been living in Denver the past 2 years, and my boyfriend and I recently moved back to Austin because we missed it so much, and we are so happy to be back. We love Austin so much. We love being a part of APS. So happy to be here and, bringing my skills to the practice as well as learning so much from all of y'all.
But so let's jump into it. When and maybe Sarah Jenna can kick us off by just kind of telling people what does structural synergy mean when we talk about these combination treatments. What treatments are we actually talking about, and why are we combining them?
I can start if you want. So typically we'll come up with, first of all, anytime we're doing something like this in the med spa, we love to create a customized treatment plan, right? And a lot of times it does combine a lot of different things. So that doesn't mean we have to do it all in one day. And actually, we'll never let you do it all in one day. That just doesn't work. But we do like to do some of them at the same time. And typically we're talking about stimulating collagen and elastin because we're looking at non-surgical options, right? Of course, we have surgical options for you too. But those of us that want minimal downtime, they don't want to do surgery, or they're looking to spend a little bit less, these are really awesome non-surgical options where we combine things like RF microneedling. We love to we're kind of stimulating at the same time, right? Both superficially and down deep. So we love to combine RF microneedling with a biostimulator. So sometimes we use Sculptra or hyperdilute radius. We even have a new device that we're bringing to the practice called SoftWave. But really hitting multiple levels at once to stimulate that collagen, we've found has really made a huge difference in skin tightening, but also overall texture of the skin, overall appearance, and like you said, both the face and the body.
And Jenna, when people are talking about these structural synergy treatments, I think trying to be real with people, it's obviously not a facelift, not a thigh lift, but you also don't have the scars and downtime as a thigh lift or facelift stuff. But it is a series of treatments and something that I think people need to understand to really get the best result. And then the other thing that we've talked a lot about, and Sarah and I have been part of it, is when you're losing weight, sometimes you need more of those treatments because some of it is trying to hold that line while you're moving. And I tell people, if you just don't develop any new skin laxity and you've lost 80 pounds, that is a massive win with the massive weight you lost.
Right. Yeah. And that's the thing, just like Sarah was saying, I mean, with the structural synergy, we're restoring the structural support you've lost through either time or the weight loss revolution. So it can be the biostimulants, they take time at 6 to 12 weeks per treatment to start see that collagen and elastin start to stimulate. But, it's more than, we're treating the the issue, not just the symptom. So whether it's, the facial fat pad separating and descending down the face, the overall skin laxity due to collagen and elastin loss, it's looking at the whole picture and figuring out how do we need to support all those structures so we can keep you looking great long term. And it's a whole treatment plan. It's not just a one-time treatment. You're going to be doing this for the next many, many years to keep looking young and flawless forever.
And that's why I think it's so great to have a provider that's going to guide you throughout this the whole time. Find somebody you really mesh with, whether it's a Sarah, Jenna, or Nikki, because what they're going to do is evaluate you, and you may have a good game plan at the beginning, but depending on how much weight you lost, kind of life changes, what's coming up, they can audible and tweak that along the way, which I think is super key. And I'll tell you personally, if I could go back and change one thing, and you guys have heard me talk about this, I would have started these treatments as soon as I started my weight loss. It's the one things I wish I could go back and change. Just I feel like I'm catching up, but you start to feel so fabulous. You want to look as fabulous, and sometimes if you start these treatments a little late, it takes a little while to catch up. Honestly, it's like the old saying goes, it's much easier to prevent something than it is to treat it later. So you don't want to wait till everything's kind of down at your belly button or knees, to start trying to lift it, because that's super challenging.
Yeah, it's less time and honestly less money to prevent than correct. So it's better to start early, as well as adding in good skincare, good home care routine. I like to say that I'm your personal trainer, but you can't leave me and then go home and eat cake. You have to eat your solids and do your good work at home too to get the best result.
And catch us up. So people who I want to talk about a few of some of the skin tightening treatments that we offer, including from RF microneedling. So for people that don't really understand, who's a good candidate for RF microneedling when you're talking about that? We have Morpheus, we have Vivace. We'll get into the ultrasound in just a minute, but a lot of really cool technology that is really improved, and really most people are a good candidate for it.
Yeah, most skin types, most skin tones. It's safe. The Vivace device has an ultrasound component, which allows us to actually see your dermis, epidermis, subcutaneous level, so we can customize the needle depth to exactly what you need.
And so the idea behind this, right, is that RF microneedling is super cool in that you can treat some of the fine lines, some of the textures, but also while stimulating some of that collagen and elastin, which I think is super cool, because we always tell people, a facelift is not a replacement for RF microneedling and vice versa, because you'd have to pull somebody so tight to get every last little wrinkle here. Nobody gets out of their convertible after going 120 miles an hour. Second, I don't know why you're going 120 miles an hour, but if you are, be careful. But three, if you are, you don't really look great and be like, damn, I wish I looked like that all the time, says nobody. So we've got the superficial, the biostimulants then affect where?
So the biostimulants are going to, essentially, the way I explain to patients is we're going to flood that subcutaneous layer, and it's going to build the collagen and elastin in that plane to kind of help tighten and support. So that's where the structural sandwich comes into play, because you have your superficial treatment and then your deeper treatment in that subcutaneous layer to kind of help stimulate throughout.
And I think you're going to see so many more of these biostimulants coming to the market over the next couple of years. I think you're going to see more of these combinations. Let's talk about a new product that we're super excited about that's launching tomorrow in our office. And so depending when you listen to this, first week in January, but SoftWave. So this is ultrasound technology. You've seen us use this from all sorts of things, whether we're talking about the Vaser, whether we're talking about diagnostic, but this is actually a treatment that people have loved because the minimal downtime, you use face, body, other stuff, actually just got an indication for lower extremity. So super excited about this. Sarah, maybe take us a little bit through that.
Yeah, I'm super excited as well. I've kind of dived into some of the before and afters that I've seen all over social media, which we can't wait to be sharing our own very soon. But it's even got a lifting component. So I think it's going to be something great to add to our repertoire as far as skin tightening goes, as far as overall texture, but also I think we can get a slightly more dramatic result. I think we're not going to see a surgical result like we said, but depending on the patient, I think being able to add this nonsurgical treatment that might give you a slightly more dramatic result than, say, RF microneedling, or if we say we need to combine it to give you the best results, just having one more tool in our toolbox to really get you a better outcome.
I'm super, super excited about doing this in the weight loss revolution with lower extremities, because I think, doing this in combination with Ovally or some of the other cellulite treatments, I think for the back of the thighs, the anterior thighs, the knees, those are such challenging areas, and anyone that's lost a little bit of weight and maybe has a little bit of mature gray hairs, on their head, probably has a few little wrinkles that they wish that they would tighten up around the knee stuff. And I think this is going to be a game changer when you add those biostimulants, some of the cellulite treatment stuff.
Yeah, luxury legs. Y'all know we love to talk about that. So I'm super excited to create a customized treatment plan actually for myself as well. So stay tuned. I've noticed after the weight loss, especially around my knees, like Dr. Franco said, and then also on the inside of the arm, I think is a really common area that I noticed a little bit more laxity than I would like to be seeing. And I think that's another area where we're really going to be combining
We're also
more.
pushing her to work out, but that's a side note. We'll talk about that later.
All right, I'm working. You guys, I fell and hurt my tailbone, so stay tuned. I know that makes me sound even older. But we really are going to start combining this with some more like hyperdilute radiescent sculpture. I think is something you're going to be seeing us do a lot more of in the body in combination with these treatments. So I plan to get on your schedule here soon, so stay tuned.
Yeah.
and Nikki, one of the things that I think people are so excited about SoftWave and why it's made such a buzz is the minimal downtime.
Yes.
Patients tend to tolerate it really well. Maybe you can touch that, but it's just for most of us, it's hard to take a lot of time off work. And if you're not doing a surgery because you can't do the downtime, you don't want to do a non-surgical treatment that takes a ton of downtime.
Yeah, so what's great about the SoftWave is it doesn't actually create a break in the skin. So you can return to normal life, makeup, activities that day.
Not that you need makeup after these treatments.
Yes.
You look fabulous.
But you can if you want. So there's no, redness, scabbing, any sort of thing you need to think about covering up, any marks. Like you just look normal right away.
So let's go around the room and just wrap this up, talking about structural synergy in terms of this. But, if we start with you, Nikki, what would be one take home you would like people to know when they're thinking about weight loss revolution, skin laxity, non-invasive, structural synergy?
I think it would just be to think about all components, like top, middle, bottom. Like you have to treat them all, starting from good skincare to, that subcutaneous, deeper level. Like you have to treat all layers to get your best results, and also a little bit of patience.
And another episode that we'll get into, but I think sometimes people don't realize there's so many non-expensive things you can do in terms of a good skincare, like sunscreen, moisturizer things. And it kills me sometimes when people are willing to spend so much money.
Yeah.
I mean, we don't mind it, the price, but you don't do the little things that are going to make such a big difference.
A big difference.
You wouldn't buy a Ferrari and not get an oil change. Like it just doesn't make sense to not do the little stuff. So great point, and definitely something we'll come back to on another episode. Jenna?
Mine would probably be don't delay starting. It's something that, like to Sarah's point earlier, we can create a whole treatment plan over the series of a year. The longer you wait, the sooner you start, the better. And then you can kind of pace it out as you're able to add more treatments on, or just to kind of see how you respond to the initial treatments. The sooner, the better, just to kind of make sure you maintain that collagen, elastin support in the skin.
That's one of the things that's exciting about the weight loss revolution. We have so many young patients in this. Young patients, fortunately for them, respond because they still have a little bit thicker dermis, tend to respond a lot better to the SoftWave, the RF microneedling treatments, and even the biostimulants. So, they have a little bit of an unfair advantage, but great for you.
But we even start losing collagen at age 25, in our 20s. So it's like you would think that you'd have to wait till longer to start these treatments, but in our 20s is when it starts. So
that explains so much.
Mean.
Nurse?
Okay, for me, I would say don't ignore the lower body. I feel like forever we have focused on the face and neck. And a lot of women, I've heard, like, I thought I was just done wearing shorts, And it's like now there are so many things that we can do to improve the appearance of the lower body. So don't be afraid to ask and let us come up with a plan for you.
Yeah, because pool party's coming up in about 6-9 months. So if you want to be summer beach ready, honestly, this is the time to do it because it does take a little bit of time. And so we got some new APS bikinis coming soon. So excited. So we appreciate you guys tuning in, starting our year off right. So Plastic Surgery Untold, greatest podcast in the world. Listen to us wherever you get your podcasts, iTunes, Spotify, iHeart, Pandora even. So we'll see you guys soon. Bye.
Bye.